My name is Inneke Vargas. I did my research with two principal investigators, Drs. Amy Chesser and Wendy Dusenberry. Our research was on assessing health literacy and stroke symptomatology in older adults. Health literacy is the degree to which an individual understands their health information to be able to make good, informed decisions on their health care. The reason why we were looking at this particular study on stroke in this demographic is because strokes affect 800,000 people annually. Each year, 75% of those people affected are in the demographic we were looking at, 65 or older. It's the fifth leading cause of death in that population and the number one cause of disability. So there's a huge need for people to understand what to look for in regard to stroke and stroke symptoms and what action needs to be taken to receive appropriate medical treatment. There are time-sensitive treatments available. One of the reasons why we did this research was to get the information out to individuals to understand that if you are experiencing a stroke, time is of the essence. Alteplase is a drug that can be administered within 4 hours of onset. If you are administered that drug in that time period, your outcome has much more positive results than if you were to let the symptoms abate in the case of a mini stroke, for example. A lot of times delayed treatment is due to failed recognition of stroke signs and symptoms by not only the stroke sufferer, but those around them, bystanders, family members, just people in the general public. 60% of strokes occur outside of hospitals. I think that is tied to the lack of recognition. Most people, if they're having a mini stroke, for example, they'll say, oh, I'm feeling a little dizzy or a little off. I'll just lie down for a while and see if my symptoms abate, which a lot of times they will, because in a mini stroke, those symptoms do tend to resolve. However, it's still a stroke, and it could be a precursor for a full-blown stroke, so it's still important for those people to recognize what to look for and realize that they need to call 911 as opposed to laying down or taking a private vehicle to the hospital. When we look at the reason why we were studying health literacy, the amount of literature available in particular on stroke is very limited. In my literature review, that was something that I had an uphill battle for, was to find information on this particular topic in this demographic. In total, from 2000 to 2017, there are only 127 published articles and I think one book in there on this topic. So we know that there's a large chasm in information that we could fill providing information to the general public about this topic. The purpose of our study was to increase the recognition of stroke signs and symptoms and to see if we could develop a concise informational presentation to a general audience and see if they can absorb that information, understand what to look for, and the importance of calling 911. The methodology for the research project, we broke down our participants into a three-participant cohort. The first participant was comprised of non-medical staff at the Oxford Grand Living Facility where we conducted our research. These were personnel who interacted frequently with the demographic that we focused on in this study. The second phase was residents, so these are our target demographic, people age 65 or older. They happen to be full-time residents of the community. And then the third cohort was family and friends, so people that have daily or very frequent interaction with the demographic as well, most affected by stroke. We did a pretest. The pretest involved gathering demographic information about our participants. It also established a baseline of stroke knowledge for the participants. The second part of the study was administering the treatment. The treatment was a 20-minute concise visual presentation in the form of a PowerPoint, and we also had Dr. Dusenberry, who is a medical professional, available to answer face-to-face questions, make the participants feel comfortable answering or asking questions that they may not have thought of if they were just given a pamphlet, as opposed to having a medical professional face-to-face with them. And then we did a post-test follow-up, which was immediately following the presentation. We had planned to do a 6-week post-test. Our numbers for our participant cohort fell to a negligible amount. We decided that the data that we gathered from our immediate post-test was sufficient for this study. One of the traditional mnemonic devices that are used when it comes to identifying stroke symptoms is FAST. It basically stands for recognizing that you may have some facial droopingness, arm numbness or weakness, speech or inability to talk, and then time to call 911. We wanted to see how effective that traditional knowledge piece for stroke identification was, and you can see that almost all of our participants identified the fourth selection correctly. However, there was one participant that didn't identify it correctly. We had a small sample number, but if you extrapolate that out to a large general demographic, that one person could represent hundreds of thousands, even millions of people in a society. So we know that there is opportunity, again, to learn or expound people's knowledge on the topic. When we did the pre-test, we wanted to kind of see what the baseline was for our participants on their knowledge prior to receiving the treatment. If everyone had the full knowledge of what stroke signs and symptoms looked like outside of the FAST mnemonic device, every selection here would be at 100% of the participants. So we can see that 26.3, that's the highest category, they recognized kind of the same symptoms in FAST. However, some of the other things like sudden confusion, maybe dizziness, loss of balance, those are lesser known factors in stroke, which can present in someone that is experiencing a stroke. And that's kind of what we wanted to hit on, those smaller, lesser known symptoms that exhibit that could be a precursor, show someone that they are having a stroke. When it came to the health literacy, we wanted to see how often our participants felt like, felt like health information was written in a way to them that was easy to understand. A lot of our participants, the largest majority, said sometimes, but when we look at the next largest category, it's never. So you have this group of people who are saying that when health information is presented to them about their own health knowledge, they never understand what's given to them, even when they're face-to-face with their primary care physician. And a lot of times, a lot of those people don't reach out to someone to have things explained to them. So there's a large amount of information that should be given to people and understood so they can understand how to take care of themselves that we're missing out on. In fact, if we look at the NAAL study, only 3% of adults in that age range do feel comfortable and have proficient health literacy skills. So if we kind of look at how many afflictions someone may have or questions about their health, they're not being answered in a way that helps them make informed decisions for themselves or their family members. The results of it were positive. Every person that participated in the study, on one of the questions that they missed on the pre-test, when it came to the post-test after treatment, they got those questions correct. So we know that this visual presentation is a very effective way to convey the information about stroke signs and symptoms to sufferers, for them to be able to take that information away and possibly spread it out to those people around them or in their communities. We know that with more than 190,000 articles available on the topic of health literacy in general, there's a huge opportunity for us to get more of this information out to patients out in the community. So the reason for this study, again, was just to increase the knowledge on the topic, hopefully save some lives, make people understand the importance of recognizing what strokes look like in themselves, others around them, calling out to 911 as opposed to taking a private vehicle to get help, because time is of the essence in this case. Short-term retention can be successful when presented in a visual presentation. Some of the limitations that we experienced was a small sample number. It was good for this study, just kind of preliminary. I know Dr. Dusenberry will do some future studies and presentations as well. So we know that with a greater group, we'll be able to get the message out on the importance of the recognition of the signs and symptoms and what to do if you do recognize those. Also, a long-term pre-test retention rate would be good to study, like we wanted to initially at that 6-week interval, to see kind of how the retention rates lasted outside of that short-term study. I want to thank the McNair program and everyone here for listening to our research and really getting into the things that we're really passionate about, and I'll open it up to any questions.